As we focus on boosters and the efficacy and the importance of bolstering the response in our bodies to the Delta variant and other variants that may come up, how problematic is it that we still do not have an infrastructure to quickly and easily get vaccines in people's arms internationally?
So it is problematic because in many countries, less than 10% of individuals have received their first dose of vaccines. Then the challenge with boosters is knowing who you've already vaccinated, where are the gaps, and how do you administer a second dose of vaccinations? And it requires a lot of micro planning, a lot of money, and then a lot of other considerations of how do we monitor adverse events and how do we scale up implementation of vaccine sites. It's what's worrying to many of us is going to be that by the time we need the booster, the infrastructure is not going to be there because we're still going to be vaccinating people in the first round.
Dr. Hansoti, there is wide disagreement on whether we've seen the worst of the Delta variant in terms of the upsurge in cases. Where do you fall on that?
So I see that the curve is continuing to go up, which is worrying. What's making me really nervous today is that there is this accompanying surge in deaths as well. So over the last week since I was last here, what I've been seeing on social media and the physician groups is people calling from Florida to Baltimore saying, do you have a bed? I have a patient that needs transferring. So we're now seeing that there has been an outstripping of resources while cases continue to soar. And you hit this vulnerable tipping point where the need is greater than the resources you have. And that's where things go awry.
How do you respond when you see Ohio State will demand vaccination? To a grizzled medical pro, and Bhakti, this is your wheelhouse, how do you respond when you see an institution, Chevron Oil, or Ohio State University say, we've had enough?
You know, I think historically back to influenza and other viruses, right? So to go into schools, we demand that our children are vaccinated.
Okay, well, wait. How did we
others.
get here? You nailed it. Okay, Dr. Hansoti, you absolutely nailed it. I lived this with polio, with parents crying over Sabin and that miracle fine. We had diphtheria from a zillion years ago. How did we get here now? Why isn't this like influenza and the others?
I think there was just concerns about what it meant to be EUA approved. That is new language to many individuals. Now that we have full FDA approval, there is increased confidence, and we can institute the same policies that we did with influenza. So if I want to work at Johns Hopkins Hospital, I have to have proof of vaccination for influenza and now for COVID, and that completely makes sense.
Does the full FDA approval, though, change anything on the margin against those who may have been hesitant?
Completely. So there is an estimation that about 90 million people were hesitant because they really didn't understand what the language of EUA approval meant. Now, with full FDA approval, we can rest assured and reassure those individuals that this is the same as any other vaccine. This isn't something new. This isn't something risky. This has the same data and the same level of approval of all the other treatments that they would take normally.
What work is being done to get children vaccinated? Tom, of course, brings up polio and likens us back a couple decades or so. What are the efforts on that front?
So I think the clinical trials have been completed for the 5 to 12-year group. The data is being combed through. We're expecting EUA approval any minute now. Pediatricians' offices already have the infrastructure due to the flu vaccination that they do to be able to vaccinate children quickly and effectively. I think it's going to be very simple to layer on vaccinations for children. And we've already seen in children ages 12 to 16 that capacity was there. And those children were rapidly vaccinated who wanted the vaccine.